Evening, everybody. So today is 2nd of December. As we've said, we are going to do an entire week of events when it comes to AIDS awareness week that we're celebrating. So let's go ahead and talk about our next guest, whom we have already brought online. They're going to start talking to you about some very important things that we all should be doing when it comes to sex. And so that's what this topic is about, sex and safety. And so that we can take care of this particular uh, event, so that we can make sure that we have all your answers, make sure that you ask all your questions, and we'll make sure that this will be a very interesting event for you. So to begin with, let me bring forward Siddharth Nandi, who is a specialist when it comes to these things. He's going to introduce himself to you when I bring him on. So here he is. Hello and good evening, Dr. Siddharth Nandi.
Hello,
Hi, I'm hoping our
good
internet
evening,
connection is
everyone.
not going to go bad because of us both being on a mobile network for whatever reason. So, yes, apologies before we begin. Our entire session may not be very clear for you to view. But yes, Siddharth Nandi, doctor, go ahead.
So, hello, everyone. I'm Dr. Siddharth Nandi. I finished my MBBS in the year 2018 from Maharashtra City of Health Sciences, and ever since then, I have been working. Initially, I worked with Bombay Hospital, then Sion Hospital, and my COVID duty in H and Reliance Hospital. Currently, I'm working with the Humsafar Trust, their clinic in Mumbai, and simultaneously also working with Dr. Safe Hands at their Mumbai clinic.
Right. So we see that, of course, all the stuff that you've told us about, it's a lot of learning. And so we can definitely depend on everything you say when it comes to sex and safety. So thank you so much for giving
Mhm.
your valuable time and being on this event with us. So that we can start, I have a question about sex and safety for you. I mean, when we talk about sex and safety, can you tell me what are the points that we're going to cover today?
So, we'll be mostly talking about safe sex practices, but for ages, we have been talking about safe sex practices only by using condoms. All right. Now, science has gotten advanced, medical science has developed than what it was before, and we have
Right,
additional tools or methods which we can employ to practice safe sex uh, to practice safe sex, and we'll be having look at these tools, like we have been regular tests, etc, etc.
right. So I wanted to ask you, when talking about safe sex, does it mean that I need to wear a condom and that's all, and that is safety? Or do you have some other things that I need to do which people usually don't consider, like maybe a lube or something like that, which is an additional support so that we can make sure that it's even more safer? Is that a point that we should talk about?
So see, Savio, uh, condom is definitely a very good tool of a safe sex practice, uh,
Hmm.
but it no tool, no medical tool or no therapeutic tool or no prophylactic tool enlisted in the domain of medical science will ever give you 100% efficacy. So even condom
Hmm.
has its own chances of failing, like if there's a case of condom rupture. Okay, during the act of sexual intercourse, obviously there is going to be friction. All right. and owing to friction, the condoms can get ruptured because it's thin latex, so it can get
Right.
ruptured quite easily. All right. So I to reduce the friction so that the chances of the condom ruptured go down, we encourage people to use generous amounts of lubrication. Now, many have this understanding that lubrication uh, is most of the time anything oil based or petroleum based. So people tend to use coconut oil or maybe Vaseline body lotion, etc., etc. The thing is, if you used a oil based lube, the chances the condom ruptured increases rather than reduce. So,
Right.
study that the chances of condom rupture go down if you used a water based lube, okay, KY jelly or something.
Right.
Uh,
So then
that
you're talking
is the
about
idea.
having.
That is the idea behind using generous amount of water based lube condom so as to prevent condom rupture by reducing the magnitude of friction during sexual intercourse. Now, irrespective of the nature of sexual intercourse, whether it's peno-vaginal or peno-anal, etc., etc.
Right. So then, one thing that I need if I'm going to have sex is a condom, for sure. That goes without saying. But there are so many people who say that condom does not feel good. It doesn't feel real. I want skin to skin contact. I want it to be, uh, you know, um, uh, like it should be real. Many people say that, and they say I don't want to wear a condom. What do you have to say to such people?
Okay. So, before saying uh, what do I have to say to such people, I would like to counter question you. Ever have you heard of these certain types of medications called PrEP or PEP?
Yes, of course, but that is going to take care of HIV, I think. What about other things
Hmm,
that I
hmm,
need to
hmm,
take
hmm,
care
hmm.
of? I mean, am I not going to be spreading other STDs if I don't wear a condom? So is it still okay
Hmm.
if I'm on PrEP and PEP to not use a condom because
Yeah.
I am safe and I'm not spreading HIV? But what about other things?
Okay. So I'll elucidate this in as much lucid way I can. So PrEP is something which a person who is not yet positive for HIV, is still seronegative on the HIV test. That person takes this medication so as to prevent oneself from turning positive on the HIV test after having, uh, not after having, it's before the person takes it well in advance uh, of having the exposure, so that the person after having a potential high risk exposure does not turn out to be positive on the HIV test. Okay, so since it is pre exposure prophylaxis, pre means you take it before the exposure, prophylaxis means prevention. So you take it before the exposure to prevent yourself from turning positive on the HIV test. In case if you at all have a high risk potential exposure to the HIV virus. All right. Now, many people have this understanding that if they consume PrEP, then probably they do not need to use condoms
Hmm.
because they might want for that extra edge of skin to skin contact. All right. Now, I would say to this that PrEP is only going to prevent HIV. All right. But PrEP cannot prevent other STDs like syphilis, chlamydia, gonorrhea, etc., etc. Now,
Right.
some may argue with me that STDs like syphilis, chlamydia, gonorrhea are curable STDs. All right. But to this, I would have people heard or researched about STDs like hepatitis B or hepatitis C? It's agreed and taken that syphilis, chlamydia, gonorrhea, trichomoniasis, STDs. You take antibiotics for certain duration of time and you're cured of the disease. But what about
Right.
hepatitis B and hepatitis C? Just like HIV, hepatitis B and hepatitis C are lifelong chronic diseases. And once you're infected with the virus, just like HIV, this virus of hepatitis B or hepatitis C is going to stay in your body throughout your life. All right. And
Correct.
just like how HIV did not give any symptoms in the initial 10 to 15 years, uh, that's just a range. Similarly, hepatitis B or hepatitis C may not give any symptoms at all in the initial years after infection. So the person might not at all know that he has been carrying this virus in his or her own body.
Right.
Similarly, just like in HIV, how we see that the body's immune system compromised, the virus attacks the body system. Eventually, eventually, if the person is not on regular medications or on ART, antiretroviral therapy, the HIV positive person lands up into uh, a high mortality condition called as AIDS, that is acquired. Right. Similarly,
Right.
hepatitis B and C can they attack your liver and only cause liver cirrhosis, and some cases it may progress on to become liver cancer. All right. So these diseases are also uh, uh, equally dreadful if the treatment is not taken for them at the right time. Okay.
Right.
uh,
So then,
what I say
basically,
is
I
what I'm
am
saying is that prep is only to prevent uh, HIV, not other wrong. Why should one take a risk?
Yeah. So I'm not sure if we are audible yet, but I think I want to just sum up what you said. That even though I think it's cool for me to feel something when I'm having sex with someone, feeling something is not as important as being safe from getting HIV, from getting Hep B, from getting Hep C, which are non-curable diseases, and also, of course, not going through all the trouble with other things like syphilis and all of these other issues. So definitely, someone who is having sex without worrying about these things uh, is at high risk and should really pay attention to these factors, isn't it?
Uh, yes, you have said it very correctly that the first priority when it comes to sexual health should be one's own safety. All right.
Correct.
Pleasure, as per me, the extra edge of pleasure should not be blown out of proportion or overhyped so that people start compromising their own safety,
Right.
compromising with their own safety, or start overlooking self safety.
Right.
This is
Now,
my
I have
opinion.
been looking. Right, right. Now, I have been looking at many different ways of trying to support the LGBT community with, providing free HIV self-testing kits through a project that we're doing. Then we are also trying to provide PrEP at a very low rate, which is actually the lowest in the world because everywhere else, it's quite expensive to get PrEP. So, having said that, what do you think is the current state of the increase in HIV, instances of HIV in people, is that growing still? Do you think there is a change? I mean, you may be meeting a lot of people, getting tested, and coming to counsel for with you. What do you see?
So Savio, I would say that my reply to this question which you have just asked is going to be very anecdotal rather than statistical. My approach would be very anecdotal, very individualistic than being very statistical. Okay.
Right.
Yes, I've seen change in the mentality of the generations. If we see the youngsters today, then they are quite aware about sexual health and about the pros of getting tested regularly and about the cons of not getting.
Right.
So, but I won't say ki all the people are, there's no absolutism. All the people for young generation become concerned or well aware about the pros of getting tested for HIV regularly or not getting tested. It's not so. There is still at least a certain fraction or amount of people who avoid getting tested due to various factors, uh, anxiety, fear of turning out positive, uh, factors because we cannot get tested. As a doctor, uh, history from patients that there is a lot of self stigma related still in the minds of people. There's still a lot of anxiety, fear, there's stress, and people mention about HIV.
Right. So you're saying that there's always been this uh, air of uncertainty and fear that's always going to be there with us because people are never going to stop fearing uh, HIV as
So
one of
see,
the
see
biggest. Yes.
to this address the fear or the anxiety in the minds of who out of fear do not want to get tested for HIV, uh, lest discover a positive status, which
Mhm.
people I would say that studies across the globe have shown that HIV positive person, if the person starts his or her own treatment as early as possible after getting diagnosed as positive, then the person easily live up to 70 to 80 years of age, provided the person is very regular and rigid about his or her own medications. Okay, the compliance, the adherence towards the antiretroviral therapy has to be very good, and it has to be as early as possible after getting diagnosed as positive. Then a person can expect a quality life, and the lifespan can be easily up to 70 to 80 years of age, which is as good as a negative person's lifespan.
Right.
Okay, nothing
Okay.
much to
So,
fear about HIV right now. HIV is no more a
right.
dreaded
But
disease.
do you see that the count of HIV infected patients has come down or gone up, or is it steadily there? Because we know in data says that it's actually going higher. What do you want to say about that? Is it going higher according to you? Do you see that as a trend?
I think, Savio, in this case, I may not have the egalitarian perspective or the bird's eye view uh, to see the entire generation or the entire population. There's a rising trend in HIV. But if I would give my anecdotal experience, I would say yes. In a week, wherever I work, I do see one or two cases of HIV positive
And
people
how many people
newly
get tested?
diagnosed. Um, on an average, I mean, it keeps varying, but if you want to ask me, in a week there may be 15 to 20.
So let's say in 20 people, you have two people getting tested positive. So that's
Mhm.
almost 10% of people who are positive every week in your case. And you're saying that could be the number in your case at least. We've heard this number is higher because many people don't get tested at all, and many people, don't want to talk about HIV at all or do any other STD test. There is like so many ways you can test for all your STDs that you may have, but nobody bothers to test for everything. They just go and test for VDRL and for HIV, and they think I am done.
HIV.
Like nobody's bothering about Hep B and Hep C as a test to be done actually.
So, Savio, the thing is, we have always associated these high risk groups or the high risk population, the communities which are at enhanced or increased risk of the HIV infection. We have associated them most of the times, and we have been still doing that. We have associated them majorly with HIV,
Hmm.
and that has somehow overshadowed the equal uh, threat of STIs. So more awareness needs to be created. These STIs as well are at par with HIV.
Right.
What I
Yeah, so that's what I'm
said a
saying.
while ago,
Don't really get
what,
tested for anything else.
yeah, what you just said a while ago, that on the basis of estimate, what I just gave you about the number of patients visiting the clinic and the number of people on a per week basis, this data is very situational, and it is a functionality of a lot of factors, and a major factor is that it depends upon people who get tested or not.
Right.
Many people may not even get tested. That is the hidden HIV population. They're carriers themselves, and they must be engaging in unprotected sex with partners still, but they have never gotten tested in their lives. Okay,
Right.
so this data, which I just said, was an approximate data of the people who get tested. We need to reach
Correct.
out population which
Right.
has hardly gotten tested in their life.
Right.
And
So,
yes, hepatitis B and hepatitis C, as you just said, get overshadowed because of the uh, majority fraction of the significance which we uh, ascertain to HIV.
right. So I have another very practical question for you, which I think our viewers should basically be asking. Um, if I am maybe this 18-year-old boy and I'm going to go and have sex with someone for the first time, what do I need to do to make sure that I am going to be safe and I'm going to have a very good time without having to worry about all these STDs?
Okay. So if you're that 18-year-old boy who's going to go and have sex for the first time in his life, and first of all, condoms are essential. Okay. Secondly, it's all essential to have a water-based lube like KY jelly. Okay.
Right,
Uh, it would be good if the person with whom the 18-year-old boy is going to hook up, it would be good if the boy knows at least a little bit of information person, so that he can get an idea about sexual behavior of that person with whom he's going to hook up with. Okay, so that might probably give an insight to this 18-year-old boy uh, to a certain risk he himself is, and probably then to get tested. So I would say lube, condoms, getting a little bit of information about your sexual practices and sexual behavior. And also, one more point, safety we usually restrict to the physical or the physiological health. But health has multiple dimensions like social, familial, spiritual, mental or psychological, etc., etc. So I would suggest if the person is going on a hookup for the first time with some unknown sex date, or for someone whom he has known for a very less amount of time, at least inform few of his friends where he is going so that he doesn't land up into crisis. So that will take care of the social and the familial dimensions of health.
Okay. So then to wrap it up, if I have to say this in Hindi so that some of us also get it, अगर मैं एक 18 साल का हूँ और मैं पहली बार किसी के साथ सेक्स करने जा रहा हूँ, भले ही वो लड़की हो या ट्रांसजेंडर हो, उसके साथ सेक्स करने से पहले मैंने उसके बारे में थोड़ी बहुत बातें जानना ज़रूरी है, क्योंकि वो कौन है इंसान, वो क्या करता है या करती है, वो मतलब सेक्स करते वक्त क्या वो प्रोटेक्शन यूज़ करते हैं या नहीं। सो आई थिंक इट्स वेरी इंपॉर्टेंट कि आप पूछो कि आपके पास कॉन्डम है क्या। अगर वो इंसान बोलता है नहीं है, इसका मतलब ये है कि उसको कॉन्डम रखने की ज़रूरत नहीं लगती, वो ज़्यादा परवाह नहीं करती या करता। क्योंकि जो इंसान ये करना चाहते हैं, पहली बार दिमाग में यही आता है कि मुझे कॉन्डम खरीदना पड़ेगा। अगर ऐसा आपके उनके दिमाग में नहीं आता है, तो मतलब वो इंसान हाई रिस्क है तुम्हारे लिए। तुमने ये ज़रूर सोचना चाहिए, क्योंकि ये करने से तुमको पता चलता है कि वो इंसान कितना केयरफुल है अपने बारे में, खुद के बारे में, और उससे अपने बारे में भी आपको लगता है कि मैं कोई एक सही इंसान के साथ सेक्स करने वाला हूँ या करने वाली हूँ। सो दैट इज़ वेरी इंपॉर्टेंट। कॉन्डम उनके पास है या नहीं, उनके पास हो या ना हो, तुम्हारे पास तो होना ही चाहिए। अगर दोनों में से एक के पास कॉन्डम हो तो बात आगे बढ़ेगी, नहीं तो आप सेक्स ना करें। दूसरी बात, अगर कॉन्डम है और आप फर्स्ट टाइम सेक्स कर रहे हो, तो ऑब्वियसली इफ़ योर वर्जिनिटी इज़ गोइंग टू बी लॉस्ट इन दिस, आपको चाहिए कि इसमें यू शुड यूज़ लुब्रिकेशन। जैसे सर ने कहा, यू हैव टू यूज़ वाटर बेस्ड लुब्रिकेंट। तो कोई ना कोई एक लूब आपको खरीदनी ही चाहिए, जिससे आपका जो सेक्सुअल एनकाउंटर है वो ज़्यादा सेफ रहेगा, क्योंकि जितना लूब यूज़ करेंगे उतना फ्रिक्शन कम होगा, उसमें आपको तकलीफ़ें कम होंगी, प्लस कॉन्डम रप्चर भी नहीं होगा। तो इससे दो फ़ायदे होते हैं, तो ये होगा। तीसरी बात ये है कि वो इंसान का फ़ोन नंबर ज़रूर जानिएगा। जैसे सर ने कहा कि यू हैव टू बी वेरी सेफ अबाउट एवरीथिंग। तो वो जो बंदा है, ये बस सिर्फ आपको एक ऐप पे मिल गया, आपने ऐप पे बात की, ऐप पे लोकेशन डाला, ऑल दैट इज़ ओके, पर वो एप्लीकेंट वो कभी भी ब्लॉक कर सकता है, और फिर बाद में आपको उसकी जानकारी कभी नहीं मिलेगी, उनकी सेफ्टी के बारे में, वो कौन था, उसने मेरे क्या पैसे चोरी किए या फिर मेरा मोबाइल चोरी किया, ये सारा डेटा कैसे मिलेगा जब आपके पास उसका फ़ोन नंबर भी नहीं है। तो सेफ्टी के लिए यू शुड ऑलवेज हैव दैट पर्सनस फ़ोन नंबर जिसके साथ आप मिलने वाले हो। एंड ऑफ कोर्स ये तीनों चीज़ हो गई। इसके बाद में अपने दोस्तों को, जैसे सर ने कहा, बताना ज़रूरी है, बिकॉज अगर कोई दोस्त को आपके बारे में कहाँ हो, ये बात जानते होंगे वो, तो अगर आपको आपके साथ कुछ हादसा होता है तो वो आपको बचाने के लिए आपके पास आ सकते हैं। ऑफ कोर्स गोज़ विदाउट सेइंग कि आप फर्स्ट टाइम सेक्स कर रहे हो, आपने कभी भी किसी के साथ में भी कोई भी तरीके का ड्रग अब्यूज़ नहीं करना चाहिए, बिकॉज ड्रग्स लेने से आप भूल जाते हो कॉन्डम यूज़ करने, कभी कभी आप भूल जाते हो कभी कभी लुब्रिकेशन यूज़ करने, और बिकॉज आपका नशा इतना होता है कि आपको कुछ पता नहीं होता, या तो फिर जो सामने वाला इंसान होता है वो आपके ऊपर से ऑलमोस्ट रेप करने के लिए, नॉन कंसेंशुअल रेप करके या कंसेंशुअली भी हार्श यूज़ करके आपके साथ में आपको तकलीफ में डाल सकता है। सो या दैट इज़ अनदर थिंग that you need to do when it comes to safe sex norms. And then finally, I think it's about feeling good. If you're not feeling something is right, if you're feeling no, I don't like this, you should tell the person to stop, because what that person is doing maybe is not right, and that is why you're not feeling good about it. So if you think something is not right, you tell them to stop. If the person is not stopping, it is wrong, because by law, when you say no, the other person should stop. अगर आपका ना बोलने के बाद में भी वो इंसान नहीं रुक रहा है, दैट मीन्स दैट पर्सन इज नॉट राइट फॉर यू इन बेड, बिकॉज वो ऑलमोस्ट आपको रेप करने की कोशिश कर रहा है, और ऐसे इंसान के साथ आगे भी मिलने की आपको कभी भी कोई ज़रूरत नहीं होनी चाहिए. So these are some factors when it comes to sexual, mental, physical, all types of healths which we need to keep in mind. And of course, Dr. Siddharth Nandi, who is working with Dr. Safe Hands and HST, gets a lot of such clients जिनके साथ ऐसा होता है, ज़बरदस्ती होती है, ये होता है, वो होता है. Dr. Nandi, what do you want to talk about stealthing? Can you explain what is stealthing to our audience, and also tell us how we could probably avoid that?
Okay. So, stealthing is a phenomenon where in your partner with whom you are engaging in penetrative sex, your knowledge wears a condom before the act of penetration, but later on, without your knowledge or without taking your consent or permission, takes off the condom. So this act or this phenomenon is known as stealthing. Okay.
So you
Now,
must be
obvious
seeing a lot
that
of people like this जिनके साथ ऐसा हुआ होगा.
I won't say a lot. I won't say a lot, but I would say, yeah, a decent enough number of people who have had this kind of experience. Okay. And how can you prevent stealing? You have to be very vigilant and observant when you have sex. Okay. Secondly, the aspect or the fact stealthing, which is very significant from the health perspective, is that is a sort of unsafe sex. It's a sort of unprotected sex. If that is occurring, then both the partners are at increased risk of uh, getting the HIV infection if one of them is probably an unknown carrier of HIV. So in that situation, if you have been already taking prep from beforehand, and if the medications are there in optimum bioactive concentration levels in the target tissue of your body, then even if you have had the infection, the potential infection of the HIV virus, still you would not turn out to be positive on a subsequent HIV test. But if you have not been on PrEP, what you can do is that after such an incident has occurred, within the first 72 hours from the time of the consume PEP, the first pill of is post exposure prophylaxis. Post afterwards, and prophylaxis means prevention. Take this pill after the exposure, high risk exposure has happened, to prevent uh, oneself from turning positive for HIV on subsequently getting tested. The first pill of this medication has to go into your system within 72 hours from the time of exposure, and the remainder pills have to be continued as a single dosage for the pending 29 days out of 1 month.
Right.
Okay,
So
so
then,
this is PEP and PrEP, how both of them are significant when such instances or when such incidents occur.
right. So then we have, I have, maybe if I'm the 18-year-old, let me be. If I'm the 18-year-old, if I'm on PrEP, I am already fighting with HIV, and that is also a good thing for me to do. if I'm not on PrEP and I end up having an issue like stealthing, जहाँ पे किसी ने कॉन्डम यूज़ करते हैं बोला और यूज़ भी किया, लेकिन बीच में ही वाइल सेक्स इज हैपनिंग कॉन्डम निकाल के कंटिन्यू किया, अगर ऐसा मेरे साथ होता है ताकि मैं HIV पॉजिटिव ना हो ऐसे हाई रिस्क इंसान के साथ में सेक्स करके, मैंने पेप लेना चाहिए एंड दैट पेप विल बी हेल्पफुल। पूरे 30 दिन के लिए मुझे लेना है विद इन 72 आवर्स से रोज़ एक एक पिल, एंड तब जाके मुझे HIV होने से मैं बच सकता हूँ बिकॉज मैंने पेप की दवाई ली विच इज़ आफ्टर एक्सपोजर। इज दैट राइट?
Hmm. So, Savvy, yeah, you're right. I would like to add something over here. Now, this was sort of an instance. Stealthing and PEP are also equally significant in situations like forceful penetration or rape, in situations like chemsex or high fun, both the people, or if not both, multiple partners do not stay in senses after doing injectable drugs so as to wear condoms. Or in situations like where your partner is forcing you or requesting you or blackmail you or trying to influence you uh, to engage in unprotected intercourse with his or her own self.
Right.
Another situation could be sex under the influence of sex or high fun. For instance, could be sex under the influence. So, in verbally, PrEP and PEP are really sick. If a person has been taking PrEP from beforehand, and if that person has to end up in any of these particular situations, then there are chances that the person is already protected against the HIV virus because PrEP, pre-exposure prophylaxis, are already present in his body at adequate concentration levels.
Right.
While if the person has not been taking PrEP, then the other option which remains with the person is to go for post-exposure prophylaxis within 72 hours of landing up into such a situation and then continuing it for 1 month.
Right. So I have another point to make. We are all talking about how to prevent HIV. There's a lot of stigma about a person who is HIV positive, and the other stigma is, why do I have to have a relationship with an HIV positive person? I cannot, I should not, he is not, or she is not really someone I need to be a part of in my life. Uh, I think that is history. That is another point of safety I want to talk about. कि अगर आपका पार्टनर HIV पॉजिटिव है तो भी आप उनके साथ में पूरी जिंदगी सेक्स करके बिता के बिना HIV पॉजिटिव हुए जी सकते हो। और डॉक्टर डॉक्टर सिद्धार्थ, अगर आप इसके बारे में कुछ बताएंगे तो मे भी हमारे ऑडियंस को ये पता चले कि HIV पॉजिटिव होना एक्चुअली कोई बुरी बात नहीं है, और मैं मेरे पॉजिटिविटी को, मतलब HIV पॉजिटिव स्टेटस को किसी और के साथ शेयर करके उनको पॉजिटिव नहीं बनाऊंगा। तो ये नहीं बनाने के तरीके आप ज़रा इनको बताइए।
So the situation which Savio you just elaborated, wherein there's a couple and out of them, one partner is HIV positive, HIV negative. Now, do relations work out? I would say yes. Such couples are called as serodiscordant couples because one of them is seropositive with respect to HIV status while the other one is seronegative. Thus, such couples are serodiscordant couples. Now, if the seropositive partner is on regular ART, is undetectable, then there are hardly any chances that the seropositive partner will transmit the virus to the negative person. But does that
Right.
mean that I am promoting unprotected sex? No, there's a catch over here. If what I just said a while ago, people interpret it as both of them can engage in protection, then to this I would say that the seropositive is in a way immunosuppressed. His immune system is compromised because of the HIV virus, the human immunodeficiency virus in his body. And if such a person engages in unprotected sex with his partner, then there are chances that he may develop some sort of EI because his immune system is already vulnerable. Okay. Uh, so there may be chances of he contracting an STI from his partner. In that case, an argument may be given that no, both are in a monogamous relationship. So from where would the STI come into the scenario? To this, I would say never trust anyone when it comes to safety. Your safety is most and the quintessential priority when you speak of your sexual health. So,
Right.
uh, as you just see, can they engage sexual intercourse? Yes, they can, but with condoms. If suppressed because of the person being regular dosage of antiretroviral therapy or ART, then it's a very good brownie point. The other brownie point can be if the seronegative person can start himself or herself on PrEP. Okay, that would be a third barrier. The first barrier is that the the seropositive person's is undetectable. Second barrier is usage of condom, and the third barrier is being on daily consumption of PrEP. So there are three layers to prevent the seronegative person from turning positive. Okay, and
Right.
it's
Right.
not a
So
stigma or
again, to just
taboo to date a HIV positive.
right.
I personally feel
So
there's no problem with being in a zero discordant relationship.
correct. So just to say this in Hindi again, so most of our people can get the idea. अगर आप HIV नेगेटिव हो और आपका पार्टनर जो है HIV पॉजिटिव है, अगर वो अपनी दवाइयाँ ले रहे हैं जो ART कहते हैं, HIV पॉजिटिव लोग ART दवाई लेते हैं, अगर वो दवाई उनकी जारी है और उनका वायरल लोड कम है, तो वो और आप अपनी रिलेशनशिप को अच्छी तरह से निभा सकते हैं। उन्होंने अपनी ART चालू रखनी है और आपने खुद प्रेप जो दवाई है वो लेनी चाहिए जिससे आपको HIV ना हो। तो सामने वाला पर्सन अगर पॉजिटिव हो, वो ART ले रहा है, नहीं ले रहा है, फिर भी अगर मैंने मेरी प्रेप ली है तो आई एम बीइंग सेफ। दूसरी बात ये है कि पार्टनर हो आप तो आपको लगेगा कि हमने कॉन्डम नहीं यूज़ करना चाहिए। ऐसी ऐसी बात आप ना करें तो अच्छा है, बिकॉज इट्स ऑलवेज गुड टू यूज़ अ कॉन्डम नो मैटर व्हाट, बिकॉज अगर आपको HIV से नहीं तो बाकी STD से ज़रूर बचाएंगे दोनों पार्टीज़ को। तो इसीलिए कॉन्डम यूज़ करना फिर भी ज़रूरी ही होगा। जितना भी मोनोगमस रिलेशनशिप जितना भी बोले कि नहीं मैं सिर्फ इनके ही साथ सेक्स करता हूँ, ये बोलने वाले लोग बहुत होते हैं, लेकिन अगर आपने किसी और के साथ सेक्स किया या आपके पार्टनर ने किसी के साथ सेक्स किया तो आप एक दूसरे को ये बात नहीं बताते। तो इसके लिए इट्स ऑलवेज बेटर टू यूज़ अ कॉन्डम ताकि आप दोनों सेफ रहें और आपकी रिलेशनशिप जारी रहे। और ऐसे रिलेशनशिप्स हैं, बहुत सारे लोगों के ऐसे रिलेशनशिप्स चल रहे हैं। सो इट्स डिफ़िकल्ट टू फाइंड अ पार्टनर लाइक दिस, पर वो अगर मिलते हैं तो फिर इस तरह से इस दवाई के थ्रू दे कैन एक्चुअली बी fine. They can be okay with all the things that they're doing. So, yeah, that is the answer. So, Dr. Nandi, are you there? Yes,
Yeah,
I'm
yeah.
sorry, your network had just gone off, but I'm thinking we're back. So,
Yeah.
another point that I wanted to make on a special day like this, where we are observing the AIDS Awareness Week, is um, everybody says that this is a very important week. There are lots of people who've lost their lives to HIV. This is the week for awareness of such things. Do we have any data on Hep B and Hep C and how it's actually working out for everyone?
So I don't remember right now, but uh, the World Health Organization does organize hepatitis weeks or hepatitis days. I'm pretty sure there is data rather when it comes to Hep B or Hep C. But if you ask me the statistical figures right now, then probably I'll fumble.
Okay,
But
but
yeah, data
however,
is available.
not everybody is as panicked about Hep B, Hep C as much as they are for HIV. I remember a few days ago when you and I were having a conversation, and you mentioned there is a vaccine for the hepatitis B, I think you said, but there isn't any for C. Is that right?
Yeah, so there's a vaccine for A and B. A, when we speak about sexual health, we need not be more concerned about because it's mostly spread through fecal-oral route. It has a uh, sort of sort of transmission, foodborne transmission, as it spreads through fecal-oral route. While hepatitis B and C is sexual transmission. So for
Okay.
C, we do not have a vaccine as of yet, but for B, we do have a vaccine.
And that brings me to the next question, which people have completely forgotten, that I need to take a vaccination shot every few years for hepatitis B. If I'm not wrong, you had mentioned something like this. Is that right?
So there are booster dosages which the person needs to keep taking.
Okay.
Not few years. So you're going for a vaccination program for hepatitis B. There are three doses take at intervals of certain months, and then you get the coverage for certain number of years. After the number of years are over and the coverage has uh, you probably need to repeat the cycle.
Okay. Because I think not everybody is aware of this factor, and so nobody really cares about it. But yes, it's a very
Mhm.
good thing to take a vaccination shot for hepatitis B in those intervals, and that will also protect you from getting Hep B, right? So
Yeah.
I think we've covered a lot of topics, Dr. Nandi. Thank you so much for all your support and for giving your valuable time in doing this event. Just so that 18-year-old boy gets all the answers that he needs, I'll take a vaccination shot for Hep B. I will make sure I'm on PrEP. I will make sure I use a condom. I make sure I have lubrication for myself and my partner both, because even the receiver as well as me can be affected if there's no lube. Um, yeah, I can ask the other person if he or she is carrying a condom to make sure that they are more responsible. I come to know their way of behavior or how serious they are about themselves. I will take their phone number when I'm indulging in sex with someone who I don't know, because a phone number is key for me to trace them. If someone robs my phone, if someone's being brutal, if someone cannot get away with something wrong that they have done whenever I'm meeting someone, I will make sure I let my friends know where I'm going so that they know how to find me if something goes wrong. And of course, in between sex, I'll be careful that the condom is not removed so that I will not be in a situation where someone will somehow give me some STI. And I'll just make sure I have a great time. And of course, after all of that, I will still get myself tested for HIV every 3 months if I'm active. And I'll make sure that the other person's also safe after 3 months. I can check with them if I want, or if they're okay with telling me that they did their HIV test. So just simple things that I think we all should do. I know there seem to be a lot of things to, but if you don't do these things, somehow you may be in a situation. We've known a few cases where there are young boys and young people who actually end up being HIV positive for no reason or no uh, you know, nothing that they did wrong. It's just because the other person was violent with them, or the other person did this, was using, was stilted at them, or maybe because they were high with some, sexual, some drugs and stuff like that, which they being a part of. So it's very important. This is a very special part of you where you are intimate with someone. At the same time, it's also a very risky time for you to be with someone. So if you follow these norms, you will be having a great time in sex, and you will be the one who'll be happy and protected, and making sure that the partner also is, by probably talking about all these things that we spoke. I know it may sound boring when you're talking about it, but maybe before you meet, it's always good to have such conversations with someone whom you're going to be having sex with. So, Dr. Dundee, I again want to thank you for your time. And I know that you've taken time out of your work schedule for us. So I really, really thank you for your time here again. I hope you have a fabulous week ahead. And if we have any need of any support from you, everybody can get in touch with Dr. Nandi at Hamsafar Trust, as well as at Dr. Safe Hands. He can, of course, connect with you on his Instagram, and he is a very nice and a very helpful person who is very knowledgeable when it comes to all these things. So please make sure that you get in touch with him. You can always get in touch with us at colorpositive.org, or our Instagram, Facebook. Make sure that you get in touch if you have any such queries. We will probably connect you to Dr. Nandi here, or to other team members from around whom we somehow can reach and help you with all the answers you need. So thank you again, Dr. Nandi, and I hope you have a great day ahead.
Uh, Welcome, Savio, for this thankful note. I'm thankful towards you and very grateful for inviting me over here so that I my bit to create awareness about safe sex practices, HIV, hepatitis B, and hepatitis C for the people who are at high risk. Thank you for having me over here.
Thank you. And for all our viewers, again, thank you so much for joining us from everywhere. Stay tuned. This content will be recorded and posted on all our social media platforms. Please watch that at your free time, but do watch it, because this is definitely something that can help you to, so that you're safe in your life. And everybody, have a lovely evening. Thank you again, Dr. Nandi. Bye, everyone.
Bye.